Hi, this is Diane Carbo with Caregiver Relief, and today I have Pat Deegan with us again, our end-of-life specialist and ex-hospice nurse. Pat and I today are going to take some time to talk about death, dying, and anticipatory grief. I feel that modern hospitals are the greatest enemy to a meaningful death. Pat, when we started in nursing, I've been a nurse for almost 50 years now. I can tell you that what was once viewed as a natural part of life has been seen by doctors and hospitals as a failure. Death has become almost unacceptable, and most modern medical practitioners are embarrassed if somebody dies. Hospitals deny people a meaningful death. From my personal experience, I can tell you, working at a world-renowned cancer center, I can see what happened. They gave people such life-altering treatments, even though the outlook was hopeless. IV fluids, blood transfusions, and other aggressive measures. And it's just so terrible what people go through. And it's unfair to those people that want to manage their own affairs successfully. And I think that people get a mixed message from the medical community on death and dying, and that's why we have so much fear.
I have to agree with you on every single point. I really do, because just chemotherapy, now everybody has the right to it, but I think if a doctor is honest with the patient, the first question I would ask, if it were me, what's the likelihood of shrinking the tumor or what have you? And then you make a decision, because let's face it, sometimes chemotherapy can be worse than the disease itself. I think we probably all see that more than once. Yeah. And I think one of the things, I know we're going to talk about anticipatory, but sudden death. Now, I saw that when I was with the emergency room, and it's such a contrast with a good death, which with cancer and lung disease, respiratory, what have you. The sudden death mourners have enormous. They don't have time to respond or to prepare, and their grief process can take years sometimes, because they have to process everything and they don't have the chance because they're thrown into the chaos of this terrible death. I help somebody right now whose father died very unexpectedly, and it's over a year, and I barely see much encouragement, but I think it'll come eventually.
Pat, my mom was diagnosed with lung cancer when I was 17, and she went through the cobalt treatment, had the thoracotomy. I mean, she went through hell. And the day she went to the oncologist for her final exam, the doctor told her, "You beat cancer, Louise. You beat it. You did amazing." She literally left the doctor's office, went to the elevator to come over, because I was just a freshman in nursing school, and she got on the elevator and collapsed and through a pulmonary embolism.
Oh.
And died that night in the intensive care unit.
Oh.
So I can tell you my thoughts on, and here's the unhealthy part of that my dad did that has affected my entire life. We weren't allowed to acknowledge that my mom had cancer and discuss that it was possible that she was going to die.
Right.
We weren't allowed to even say the C word, because that was terrible. So when my mom beat cancer and still died because of the complications of the treatment she received, I'm still, to this day, and my mom's been dead 50 years, I am still grieving her loss.
Oh, absolutely. Oh.
But I'd like to discuss anticipatory grief, because I went through that as a kid and didn't know what it was when we were going through the process with my mom's diagnosis. And I know many family members don't understand what that means, or that even that there are grief.
Yes, that's very important. Sometimes they don't even realize it. Subconsciously, they're absorbing what's going on, but if you went up and asked them something, they would deny it. They just can't. It's too much to cope with. I can mention a couple of contrasting symptoms, if you will, between the person and the family mourners. I think
that would be great.
The person, it's the preoccupation with the fact that they're dying. because underlying, even though they might not say it, this is all they're thinking about. Uh, they long for who they used to be or what they were, because that's going to be taken away from them. They have cognitive changes in their personality. They become very lonely, cheerful, irritable, angry, withdraw, and yet with all these things, they still have a need to talk, but they don't realize it, and it's hard for them to communicate. It just takes over their whole being.
I have seen that in cancer patients, in COPDers, chronic obstructive pulmonary disease patients, emphysemics. I have seen it in those individuals over my years of nursing, where patients are ill and they're fearful, and they become very drawn within themselves as they start to deal with, are they dying, and are they prepared to die?
You're saying that reminds me of a patient. It wasn't cancer, but it was life threatening, and it was going to take him. And he was, I hate to say abusive, but he really lashed out at his wife every day, just over and over again. And it was the hospice team that came to her rescue because he felt comfortable screaming at her because he couldn't do it to anybody else, and he felt that she could take it because she was his wife. And once she realized what he was doing, he would never really accept it because he didn't think he was yelling at her. But
Yeah.
she was able to, I don't know, comfort him. And that brings me to another point. There's some people, and there's certainly opposites, that are extremely angry because the patient is dying. He's never been here. He was never here for us. He drank all the time. I never knew when he was coming home. And now she's being forced to take care of him. And she's very angry about this, and she doesn't know how to deal with it. And you see that not a lot, but you see it as a
Pat,
problem.
I was a teenager. My mom, I was driving her for her cobalt treatment. Her skin was burned. She had an incision in her chest at her below her collarbone, the thoracotomy, where gallons of fluid would spew out of her. And my dad didn't want to deal with it, so I was forced to deal with it as a very young woman. And I can tell you, I was so angry, not at my dad, but at my mom for being sick. It's not normal. I felt shame for so long because she was always coughing, and I thought,
God,
please stop coughing, you know. So I understand that anger and that rage, and some people get mad at God. Some people get, that's a big one. Why? So I know that when people are getting a diagnosis or taking care of a family member that is in a decline, anticipatory grief is real, and people don't understand that that's what they're going through.
and everybody that gets this death sentence, so to speak, is going to do it. It's just,
Yes.
you think about everything in your whole life. What did I do wrong? Is there somebody I need to make amends with? Everything. And some of the people just don't want to talk about it because they don't realize how important it is to get it off their chest.
Yeah.
They just don't.
Yes, and I can tell you that my mom died suddenly, and it negatively impacted my entire life because my dad wouldn't let us talk about it. And then when my mom did die, he had another woman in his life right away, so we weren't even allowed to discuss. So it was very hard, and it was very unhealthy.
That's a classic case of exactly what we're talking about.
Yes,
Really?
yes,
Yep.
yes. There's also, people have a fear of death. And one of the biggest fear that they have is with high-tech medicine, they're being afraid to be locked into machines and losing control of their own lives. And so we go through this grieving process where you're afraid to die, you want a quality of life, and I think that the medical community really fails us because they continue to treat and treat.
Yeah.
Sometimes to the point where they hurry along your death versus delay your death.
Right. Yeah, they just take care of the medical modality. They don't think of the spiritual or any other parts of the human being. Yeah, I've
Yeah.
seen that more times than I would like to remember.
Oh, me too. It makes me sad.
Yes, it does.
It makes me sad because people, first, when they get a diagnosis, whether it's the family member that gets the diagnosis with a chronic illness or a terminal condition, or it's the family member, like the family caregiver, that's having to take care of them, you go through the shock, the denial. No, this isn't me. Then the anger. Then you go through bargaining. And I think that's where the medical delivery system fails people, because the bargaining is, to some people, is just reaching out to grasp at any kind of thing to prolong their life.
Yeah, yeah, because they'll say to themselves, "Oh God, I've been good. I've never killed anybody. I've been good to my wife and everything. Just keep me alive long enough to see my first grandchild, or let me live long enough to see my daughter get married." And that's a big part of the different stages of accepting the fact that they are dying. But it isn't easy, not at all. And people, I don't think, realize just how difficult it can be if they don't have the help from other people to guide.
And exactly. And caregivers are dealing with this too, because they're seeing the decline of their family member. They're also bargaining, and this is when the doctors say underutilized hospice. Palliative care and hospice are so underutilized by the medical community because they feel that it's a failure. And family members need that, and family members need to be proactive and say to the doctor, what would you do in this situation if it was you
That's right. Absolutely.
or your family member? Because doctors can push until they are responsible for almost killing people.
Mm-hmm.
And they do deny them a peaceful death in a lot of ways.
I agree. Yes, you've taken some points very well taken, because it's such a traumatic to anybody, even when you expect it.
Yes.
I knew my husband was dying, but what was important was he wanted to die at home. I don't know if that's what he said, but I don't know, maybe because I was a nurse. I don't know. But I was able to tell my children exactly what was going to happen next. My were still alive, so they had nobody in their life that had died yet, and here their father's dying.
Wow. Yeah.
He's going to do this. It's going to happen like this. And after our talk last week, I remembered one of my daughters was so concerned because my husband didn't want to eat anything. And I said, but all his systems are beginning to go, and if we force him to eat, it really does cause pain in these patients because the body has to work so much harder to metabolize it. And one day said to this particular daughter, could I have a popsicle? Well, she was the happiest little girl on earth because here she could do something for her father, and he was going to eat something.
Yeah, there you go. You're bargaining with God. You're bargaining with the universe. You're bargaining for a cure or to prolong life. And when people come to the realization that they may not be prolonging their life, but prolonging pain, suffering, or whatever, they become very depressed.
Oh, yeah, and they would withdraw, and they don't watch TV, and they want to nap all the time. They really do withdraw. Yeah.
Yes. And so do family caregivers.
Oh, God, yeah.
They
most important people.
Yeah, and you've been there. I've taken care of my father and my mother-in-law, and you took care of your husband and multiple hospice patients. So you've seen the family dynamic.
Yep. I certainly have. And I think what's important, for the families, let's say, is that you can give them a rough idea of what's going to happen and when, like months before death. They need to know how he's feeling when at all possible. What's going to happen next? What is he going to do? And months before, they do withdraw. They really do. They don't watch TV. But this is the time for them to write out their will if they don't have one. Hopefully they've got one before then, because they've got to have their affairs in order, so to speak. And if there's a relationship that's broken, they need to make amends for that, because that will also lead to a much more peaceful death than if something is hanging over them.
And people don't really understand how important that is. I'm going to tell a story about when my dad was passing. He was in the last stages of his death and dying process, and he had gone into a coma, and we put a hospital bed in the living room. Now, my brother had been away in Florida, my youngest brother, and my dad and him had a good relationship. So my dad was in a coma probably for 24 to 48 hours, and my brother, we told Dad, Paul's coming. And my dad hung on to be able to give my brother an opportunity to say goodbye. I'm sure of it.
Mhm.
Because within an hour after Paul got there and talked to my dad and spoke to him, and we sat around as a family, and my dad died.
Mhm.
And I'll never forget that, because I gave my brother Paul so much comfort to know
Yeah.
that Dad waited for him. I can remember I had my hand on my dad's chest, and at the end of life, your heart's pounding so hard, and the respirations are fewer and further between. And I read he had a St. Joseph's prayer card he used to say every day. And people have to understand that hearing is the last sense to go. So while my dad was actually crossing over, so to speak, I took his prayer card and I read his prayer out loud while I had my hand on his chest, and I felt his very last heartbeat.
Mm.
He was surrounded by his family, and he had a very comfortable, peaceful death. And I think it's because first of all, I'm a nudge, and we sent him off to Hawaii on hospice and everything so that he could do whatever he wanted to do. But I also see, and I know you've seen this too, where sometimes people die after the family has left.
I just got that point up. Yep, they certainly. No, they really do. I had a patient. The donor was going to take care of her, and they did everything together. Everything. They were like two peas in a pod, and she was afraid that she wasn't going to be able to take care of her mother. So we went over everything, how to give her a bath, how to do all these things, and the mother really rallied there for a while, and then the daughter had a chance to go away on a special weekend, so we all encouraged her to do that, including the patient. She said, "Don't go. I'll be fine. I'll be fine." But of course, the mother died while the girl was away, and she came back and she couldn't forgive herself. But all these things were going through her mind, and I looked at her and I said, "Your mother chose her time to die so that you didn't have to witness it."
Yeah.
She didn't know what to say. It was like lightning had struck her, and she came into my office several years later, and with a friend, and didn't realize that I was the nurse that was going to be there. And she recanted this whole thing, and she said afterwards, when I thought about her, she said, "My mother always used to shield me from the worst parts of life," and she said she did it in the end too.
God bless her. Yes. And that is such an important story that you shared, because I have seen it, especially at the cancer center, where patients, they hang on and they hang on and they hang on, and the family is vigilant about being there, and they don't want to leave. And it's after they leave to go home and take a shower and get some rest that the family member chooses to die. And you just don't know why, but you think that the family member chose when they were gone for a reason.
Absolutely. Absolutely. Yep.
They really do.
I believe that because I just know my husband did the same thing. Everybody was stayed at the house and everything, and when they had all gone to work or gone out to get something or anything, that's when he peacefully went. So when they all came back home, which was like maybe an hour later, I told them that he had passed, and again they were not angry, but disappointed maybe that they couldn't have been there. And I said, "No, that's what your father wanted."
Yes, and people could find comfort in that as well. That's why it's important to have those conversations early on and ongoing, and work through the depression, because eventually people have to accept that they're dying. I'll never forget this one young man. He was so handsome, and the cancer treatment that he had left him bloated and unattractive to him, to his appearance. And I'll never forget, he's starting to actively die. They put him on hospice, and was talking to his family, and he goes, "Am I going to die looking like this?"
Oh gosh.
And I felt so bad.
Oh.
I had to say yes, and it was then that he accepted his fate. that, his death was inevitable.
Right.
We didn't even get a chance to send him home because once he accepted that fate, and he was young, he was in his 30s, late 30s, he died that night.
Wow.
And I think that he accepted that I'm done fighting. This is not working for me. And he just gave up. And people don't realize that when people do that, it's not a bad thing. People say, oh, keep fighting, keep fighting. What are you fighting for?
Like more pain and more suffering. No, that's tough on the family. They won't accept it, do they? Oh, no, I want to be here. I want them to live and stuff, but they're being very selfish, I think.
Yes, it is.
In the hospital setting, everybody knows they're understaffed. God knows they are. And most of the nurses, LPNs, or orderlies, and God forbid, even the doctors, know so little about holistic medicine or hospice. I know we're talking about hospice a lot, but it's such a natural death. It's a natural state of life, unfortunately. And
Yes.
don't have the time to sit down and talk to them, nor do they recognize some of the symptoms at all because it's not taught in school.
Yes.
And
Exactly.
never talked about hospice. I think they do now, but I'm not positive.
Yes. That's why I want to talk about the process of dying, because people have to understand that when you have a progressive disease, you may have a functional decline if you have some sort of cancer, or you've got an indefinite, prolonged, or severe functional decline, like an Alzheimer's disease or a stroke. Then you have heart problems and pulmonary problems like chronic obstructive pulmonary disease, where you have irregular, unpredictable, and sudden exacerbations that decrease your functional abilities over time. And then, of course, there is the sudden death, which, like the heart attack, or as in my mom, the pulmonary embolism. So we can't predict the timing of death, but we can tell you that for some of these things, when you start to have a decline in your body changes, the inability to walk or breathe or whatever, that's when you should start talking, because you've got probably maybe a year to 2 years for Alzheimer's, and maybe more. But there are things like now people are given the option: your heart's not working, you're having dizzy periods called syncope. Let's put in a pacemaker, or let's put a defibrillator in, or let's put a feeding tube in. And again, it comes down to you have to know what you want, because there comes a time when you have these conditions like a cancer or Alzheimer's or COPD or emphysema, where the pacemaker, you may want to have it turned off, or the defibrillator turned off. You may not want to initiate feeding a person, take active measures. So there are a lot of things that are going on, and I think that one of the things people need to do is, if they have fears of death, they should have goals for the end of their lives too. And I think the majority, I know for me, I don't have fear of death. I just don't want to die in pain.
Oh, I think
and
people would certainly agree with you on that point. Absolutely.
Yes. And a lot of people are afraid of dying alone. And I respect that. I have a really hard time with, and I've told this story before, about there are people in nursing homes where they don't put them on hospice soon enough, and they die alone. And that makes me feel sad.
Yes, it does. Yeah, because nobody should die alone. I know I've said that before on a couple of other these podcasts. Absolutely. I think a good death, if that's such a thing, I think is, like living long enough to see your grandchildren, let's say. My husband never saw his grandchildren.
Right.
Whatever.
Hey, my mom never saw me got married, never saw my babies, never saw me graduate from nursing school. We missed a lot of sharing with my mom.
Oh, yes, you did. And I think, like there's the phrase, time, the hardest time, especially with sudden death, like the first Christmas or the first Thanksgiving or his first birth, the anniversaries of all those are really tough for some people to get through. And you have to acknowledge this and offer them some kind of compassion or some kind of outlet for them to express this. Because I think that
Yeah.
should go by the wayside too. People do not understand. It's too bad everybody can't go through hospice once.
You know what? I think that everybody should be expected to volunteer as a hospice volunteer for a while just to see so that they don't have the fear of death like they do. Another concern that many people have is the financial concern of death and dying. And I'm not talking funeral planning or anything like that, but the healthcare costs.
Oh,
And people don't understand that the healthcare costs have been steadily increasing. And many spend their entire life savings to prolong the life of a loved one.
mhm. My brother-in-law died 3 weeks ago, and he was never really admitted to the hospital with it. He was in the emergency room. They did blood work and, EKGs and stuff like that, but never actually admitted to a room. And my sister said, am I going to get charged for a room and all this stuff? I said, I don't know. I said, you're going to get emergency room charges, but if he never actually got into the bed on the floor, you might not get that. She got the bill the next day. Now he was
Mhm.
so many hours, $64,000. I said to my sister, what? She said, nothing, Pat. They did blood work, did the EKG, things like that, but she said nothing else. 64,000.
Yeah.
And he was never admitted to
Uh,
the room. But
well,
she didn't have to pay much because they had insurance, but still, imagine
yeah.
that's a lot of money.
Occupational therapy, physical therapy, home care all adds to the cost of financial concerns of keeping a family member alive. And these need to, and co-pays are phenomenal nowadays. Even just getting a blood transfusion is challenging. So I think that people need to have discussions with their doctors on many levels. There is a movement. It's the death awareness movement
Oh,
that has started up, and it's based on Elizabeth Kubler-Ross's On Death and Dying book. And it again, what they're talking about the stages of death, and it's because of her work, death because of the aging baby boomers. It's a public issue now that we have. It absolutely is, and it's death with dignity is a real issue for many people because more and more, especially Americans, they want to demand control over their medical treatment. And again, it has to do with death has become such a complex issue. And I think that we need to have more discussions about death, and people need to express an interest in how they want to die.
the people have to take over their own decisions on what to do and not let the medical professionals sometimes say, oh, you need this. And you just have to stand back and say, no, I've had enough. We'll just go with, palliative care from this point or something. And I think the more dialogue we have with the public, this will
Yes.
probably change.
It is, because I know that one of the big fundamental questions is, do people have the right to die at a time and a manner of their own choosing? And with the lack of caregivers, the lack of healthcare coverage, the lack of pain management and treatment of symptoms now, people are also looking at the right to die. I belong to a group called Exit International, and it supports. It's very fascinating. I'm learning about Switzerland has their death with dignitas and stuff. So people are choosing not to decline. They're choosing to take life or death into their own hands. And that is something that I think as we get older, as the baby boomers age, we're going to hear more and more of that. One of the co-authors of Obamacare, or the ACA, is Ezekiel Emanuel. He is an oncologist and a Harvard-trained physician who feels that nobody should live after the age of 70.
Really, even though
And
age now has risen considerably. Oh,
yes, but his thoughts are that there's no insurance coverage to prolong life and stuff. And I think we're seeing that movement starting with Medicare because they are covering less and making it people more financially responsible for the treatment that they want. So I think that is an underlying philosophy that will start to become more and more mainstream as we get older.
Yeah, I think it'll take hold, and you'll see more and more countries or whatever sanctioning the will to die or to take it into their own hands. I know.
Yeah.
Right. Yeah.
And we do have, right now it's in this country, we have a few states, but you have to be almost on your deathbed. And there are many boomers that have dementia and don't want to put their families through that. They have deteriorating neuromuscular diseases like Huntington's or Lou Gehrig's, and they don't want to get to a point where they're dependent on anybody. And at this point in time, that is not an option for people.
Well, no, unfortunately, but hopefully that'll change.
Yeah, I'm hoping over time because it's something that people have to consider because we are in an era where we don't have the caregivers to take care of the aging population.
That's right.
And the family members have a great burden. 90% of home health care, unpaid caregivers, is done by family members in this country. So there's the intergenerational living is going to be back in swing, in vogue, as you will, because the aging family members are being cared for by their children and their grandchildren.
Mm-hmm.
But I thought that maybe we could, because of your hospice experience, Pat, we would talk about the end-of-life signs and symptoms. As you're getting there closer and closer to death, it can come on quicker, it can come on sudden. My dad's was over a period of months, and he was on hospice. We did discuss the loss of appetite. They don't want food.
No.
They don't want to drink. And people think, oh my God, they're going to be dehydrated or whatever. Don't eat when they're hungry. It isn't something to feel distressed about. That's where it comes in with, oh my God, I can't. You're not going to give them hydration. You're not going to give them a feeding tube, or you want to stop feeding them. People don't understand that the death and dying process, your body shuts down, and giving them these things prolongs pain and suffering.
Yeah, we could maybe do that the next time. I can try to get it down like months before, which I mentioned, the loss of interest.
Yes.
Your conversation, but as it gets closer, but a lot of them, it depends on what the diagnosis is. They might change a little bit, but there are certain things that you can, the condition of the skin, their urinary output, and things like that.
Yes. You know what? Let's talk about that next week. Let's put the signs of death, the end-of-life signs and symptoms, to help family members, because I know one of the things that I've had with several of my caregivers is there was such a disappointment because they had lack of education of what they were observing. And there's good hospice companies and they're bad. So let's do that next week, Pat. We'll do the signs of death, the end of life signs and symptoms, and that'll help people get a feel for what they're going through and what they can expect.
And I think, too, we could just touch on that next week. And I think most people don't think of these things are the religious aspects of, like, some of the religions don't believe in autopsies or cremation or anything. But I just touch that lightly, just so that they know, depending on what the religious affiliation is, what they need to know is acceptable and what isn't.
You know what? That would be great. We'll cover all that next week.
Okay.
To my caregiver friends out there, I want to say, remember, you are the most important part of the caregiving equation. Without you, it all falls apart. So learn to be gentle with yourself. Practice self-care every day because you are worth it. Pat, this was great. I thank you for your time, and I look forward to next week.
Okay.
All right. Bye.
Thank you.
All right. Bye.